there are words that may not be translatable in one's native tongue. That exists all the time.
Language barriers leading to misdiagnosis for someone who doesn't speak or understand English. The problem can be dangerous, even deadly.
Well, now an ASU grad has developed an app to help with that. As Max Gordon explains, the inspiration for this technology is born from tragedy.
Aziza Ismail scrolls through a series of cartoonish pictures depicting different discomforts.
For example, we have a character with fever, and you can kind of see how she has a thermometer in her mouth and her head is red and she's sweating.
It's called Literacy, using pictures and simple language to allow patients to describe their symptoms even if they don't speak English or can't read.
Pictures were one way to communicate more universally.
The origins of the app came from personal experience.
My family came here from Afghanistan after the Soviet-led invasion, so I had grown up with always seeing the struggles that my parents had with literacy and the language barriers.
And then tragedy struck her family.
I had a 10-year-old cousin who went to the emergency department with a life-threatening condition, but because of a misunderstanding of her symptoms, she ended up waiting to see a doctor in the ER, lost her life while waiting to see a doctor in the ER.
According to the American Medical Association, more than 3/4 of medical misdiagnoses are because of a breakdown in communication between doctors and patients, leading to between 40 and 80,000 avoidable hospital deaths each year in the U.S.
The word may not exist, or it might not be culturally appropriate, or we might have to use a different type of word to convey the same meaning.
Dr. Krista Johnson Agbakwu at Valleywise Health's Refugee Women's Health Clinic has been using the app. Early data shows that patients are either sharing the same or more numbers of symptoms than they would when communicating with a doctor face-to-face.
It's very novel, it's innovative, but there's great opportunity for us to really further hone the science.
And while her cousin couldn't be saved, Aziza hopes to expand the app to other hospitals and help more people in the process.
This is something that could potentially help save a lot of other lives.
Max Gordon, Arizona's Family.